Are you currently suffering from neck pain? Neck pain that might be acute, meaning it just happened recently within the last few days or weeks, or is this a chronic condition that you've been dealing with on and off for the last few months, if not even years? Oftentimes we hear people come into our office and just say, oh, I have a bad neck, I have disc degeneration, I have degeneration of the spine, and that's the reason why I have neck pain. Now, although neck pain might seem common, it is not uncommon for this condition to be mismanaged. Oftentimes our patients are being put through the ringer, whether that's massage, acu, PT, chiro, primary, shots, orthopedics, without the proper understanding of why the pain is even there in the first place. So if you're dealing with neck pain, this video is for you. If you have a family member who's been dealing with either chronic or acute neck pain and they're looking for some support, please share this with them. In this video, I'm going to break down the common causes of neck pain, but more importantly, our approach, the Live Loud approach to handling neck pain and musculoskeletal conditions by showing you a few of the tests and ways we determine what the cause of pain is. But more importantly, what are some things that you can do about the neck pain right here, right now, right when you're done watching this video, but also as a long-term approach to helping with neck pain due to the common reasons as to why. Now, in addition to that, right, we talk about the platform and the philosophy about how a movement-based approach really helps you as an individual deal with really any sort of aches and pains that you might be having. All right, so as we were saying with neck pain, a lot of the issues that you're gonna be seeing with neck pain are overuse in nature, but it's almost from a stagnation perspective, right? Your head weighs 12 to 20 pounds, and based on our somewhat sedentary lifestyle for Western civilization, is it puts a lot of tension on the back side of your neck. Thus, those muscles are constantly having to contract and hold, creating tension and tightness, and then we create this negative feedback loop. So what we're gonna first and foremost do is just make sure we rule out any sort of structural issues. But again, outside of you having trauma, an accident, or something like that, the likelihood of that being the case goes down. So what we're gonna have Rachel do is sit up nice and tall, and I'm just gonna basically push down. Perfect. See if there's any pain or trigger of her symptoms. Now, good, we're gonna go to the side, we're gonna go to the other side. Now, one thing to consider though is in the case of neck pain, if you're having any sort of radicular symptoms, meaning you have numbness, tingling, or maybe pain down the arms, this is what we're trying to look for. Maybe is there a disc issue or some sort of encroachment on a pinched nerve at the actual spinal level? If those do not replicate that, then we're gonna be looking at the soft tissue structures within the supraclavicular area, so like right in the soft part of your neck here where all the nerves come out of. But that's what we're trying to look at. Now we're gonna look at basic range of motion. So I'm gonna have her tuck her chin down to her sternum. Perfect. We're gonna look all the way up. Perfect. Back down, look over your right shoulder, left shoulder. Awesome. So active range of motion's good. We would assess passive range of motion as well to determine if there's any sort of issues. Now, for some people, they're getting neck pain when they're working out. So there might be a technique flaw that we would have to address. Commonly, we see this with overhead pressing where someone is driving their neck through, essentially just creating a pinch point in their neck. Now, the other thing that we have to look at, I'm gonna have you go on your hands and knees with your feet just off the edge here. Where does your head attach to? Your head attaches to the upper part of your back. So we have to also address what's the range of motion and mobility within the thoracic spine, and is that affecting where the position of the head is? So all we're gonna have Rachel do is a cat-cow. She's gonna round out. Yep, perfect. And then drop down. So we're gonna look for extension. Now notice, in doing this, we get a lot of spinal motion. So to segment out where we want the mid-back, come back up to neutral, sit your butt back down towards your heels, now do the same thing. So now we can isolate more of the thoracic spine and see if there's any sort of limitations. Commonly, we're seeing an extension limitation, meaning we're more rounded forward, and that's gonna put your head forward, putting more pressure on your neck or that CT junction, or where your neck meets your upper back. Okay, so this is an important distinction of understanding, is the neck issue actually coming from a different neighboring area, or is it just from stagnation and not moving a lot? So, perfect. Perfect, go ahead and stand up for me. So next what we're gonna have her do is we're gonna have her lay on her back face up. So from a manual therapy side is we know there's a ton of benefit from doing soft tissue work. We like to pass a lot of that off onto you at home so that you can become autonomous in your care and address the tension that you might be feeling in between our sessions. So we're gonna be doing essentially just basic like pin and stretch, ART types of motions to help work on any of the tight spots, but this also helps me palpate to determine what areas do we need to focus on more. Now, obviously, you as an individual, you'll be able to feel where you're tighter in certain areas and or more tender, and you'll want to focus on those. So we're just going to work all these different spots within the session, especially these suboccipitals. So the suboccipitals are underneath your occiput, which is the base of your skull on the back. Now, why are these so important? Well, many of us are doing some form of computer work nowadays or on our cell phones, reading, whatever that is. These are directly tied to eye writing reflexes and leveling of the head. So if I am rounded, I'm gonna have to tip my head up to be able to see level to the horizon. So oftentimes these get extra tight. So we're gonna do an extensive amount of work here with fingers and or maybe dry needling to help relieve the tension here to open up range of motion, so on and so forth. Now, these can also be worked on at home. I'm gonna have you sit up just a little bit with trigger point balls. Good, now come on back. With trigger point balls in a yoga block, we have two balls that are basically together. Now these are gonna basically cup and hug the suboccipital muscles where we were just working. So now Rachel can take this exact same tool at home to work on the tension in between our sessions during her micro breaks while she's working on the computer or at work or whatever that might be. She can start to turn her head side to side, up and down, and basically draw different shapes to hit different angles and corners to make sure she's getting all the areas that she can. Now, a couple important things. Perfect, go ahead and sit up for me. A couple important things to note. This goes true for any part of your body. Once you've established more range of motion or decreased pain, you have to put that into context. You have to show the body that the pain that you previously had has improved or that your range of motion. So one of the movements that I love, especially for the neck, is called movement mapping. What we want to assume is that we have like this, imagine this like space globe around your head, right? And you have a marker or something on the top of your head, and your goal is to cover the inside of the globe as best as you can. So she's basically gonna try to paint the inside of a globe and go through all of these different ranges of motion. Now, the reason why we call it mapping is she's gonna have a better understanding about where her tight points are, where maybe we're getting some kinks in this system as well, but more importantly, all the range of motion that we've been improving through adjustments and soft tissue work, she now can translate into better and more movement. Now, we would expand upon this too with some sort of resistance training, whether that would be a plank or even like a bird dog, and something where she would have to stabilize and hold her neck and teach it what we want for as far as not only range of motion, but also stability. Okay, so these are a few important tools that will help you not only handle your pain throughout the day if it's something that's kind of chronic and or ebbs and flows based on how much you're either at a computer or how much you're driving and commuting, all of which have the effects on how much load or pressure is going on to the neck. But again, it also creates a frame of reference and context as to how you can improve your range of motion and gaining more confidence with your neck rather than just staying stiff and turning your whole body when your neck's hurting, right? Because then it's just gonna get tighter and tighter and build upon itself. So as far as this movement mapping principle, right, it not only helps you take away a lot of the pain and discomfort, because again, stagnation just makes you tighter, right? So we want to break up stagnation with movement, that simple. But as you improve range of motion, whether through adjustments, trigger point work, at home or in the office, we have to create more context. If you don't use the new range of motion that we've just established, then you're just gonna stay tighter, right? You have to teach the body what you want it to do as far as from a functionality point and just simply range of motion, but also stability. So what I want to encourage you guys to do, right, is first and foremost, take the exploration model. That is by far the foundation of every part of my conversation, whether it's neck pain, knee pain, or shoulder pain, is it helps you better understand where your sticky parts are, where you're tight, where it's painful, so that you have a better idea of maybe what to avoid or what to dive in a little bit deeper on to see if you can improve it. This also creates a better context for me to have a conversation for you if you want some help and support coming into our office to deal with this potentially chronic issue that might be having, or something more acute where maybe you just woke up with neck pain and you feel like you can't move. Having more context around your pain will help me determine what the best course of action for you to help you get back to all the activities that you want to be able to do and live a loud life. Thanks for tuning in, guys.